Bismillah ar-Rahman ar-Rahim. My name is Abdullah Al-Khairi and I will talk about airway management. We will start with our objective. We will start with causes of airway obstruction, ways to open the airway, and finally we will talk about equipment used to open the airway. It is very important to know airway anatomy. As you see here in the picture, this is the nose, and this is the oral cavity, and this is the tongue. All of them will go to here pharynx, and we have the trachea and esophagus. Remember this picture because you will need it to choose your equipment. Okay, the main causes of airway obstruction, we have tongue. The tongue, if patient become unconscious or he have CNS problem, this will cause the tongue to go back and this will obstruct the airway. The other reason of obstruction, we have edema or post-extubation inflammation. We have bleeding, secretion, foreign bodies, and the last one is laryngospasm. All of this will cause airway obstruction. So, what is the ways to open the airway? We have two ways here, as you see in the picture. We have the first one, the most common. We have the head till chin lift. You will put one hand in the head and the other hand in the chin, and you will lift the patient, and this will cause airway opening. The second one is the jaw thrust. This usually we use it when the patient have spinal injury or suspected spinal injury. We will use this way to protect the patient. So this way you will put your finger in the jaw and you will rise it up, as you see in the picture. Okay. So now we will go to artificial airway. We have a lot of devices in artificial airway. We have the oropharyngeal airway, the nasopharyngeal airway, the laryngeal mask airway LMA, esophageal tracheal combi tube, and the final one is the endotracheal tube. As you see in the picture, here is the oropharyngeal airway. There are different sizes and we have to carefully choose the right size, because if you choose the wrong size, this will cause harmful to the patient. If you use big one, this will cause obstruction to the airway, and if you use a small one, this will not open the airway. So how to choose the right size? We will put the oropharyngeal airway in the corner of the lip to the end of the corner of the jaw here. That means this one the right size. Okay. So how do we insert oropharyngeal airway? First, we will insert it with top toward of the mouth. Then we will rotate 100 degree and we'll insert it to the resting position. This oropharyngeal airway, usually we don't use it with conscious patient, because if you use it with conscious patient, this will cause gag reflex and the patient will vomit. And if he vomit, he will aspirate and will cause another problem. As you see here, there is a channel in oropharyngeal airway. This channel we can do suction. We can insert suction catheter and suction the patient. Okay. Now we will go to nasal pharyngeal airway. Nasal pharyngeal airway, same as oral pharyngeal airway. There are different sizes and we have to choose the right size. So to choose the right size of nasopharyngeal airway, you will put the tube near the nose to the end of ear loop. This is the right size of the patient. And to insert it, we have to lubricate the tube first and insert it slowly. If you feel resistance, don't force to insert it. Remove and insert again. Now we will go to LMA, laryngeal mask airway. What is the indication of laryngeal mask airway? The first indication is difficult face mask fit. Second reason is unsuccessful intubation and difficult ventilation with bag mask. The third reason is unavailability of personnel trained in ET intubation. The last reason for LMA, elective surgical procedure. The contraindication of LMA, healthcare provider not trained in the use of LMA. The other one is if risk of aspiration exists, because if you put LMA, you cannot do section. So if patient have risk of aspiration, don't use LMA. As you see in the picture, this is the LMA, this is the mask, and this is the airway tube, and this is the cuff. And to inflate the cuff, you will need a 20 cc syringe and put air from this pilot tube. How to choose the size of LMA? By weight of the patient. You will see the weight of the patient and you will choose the size. For example, here, if the patient weight from 50 to 70 kilogram, we will use size 4. If it is more than 70, we will use size 5. So how do we insert the LMA? First, you will lubricate the tube, then you will hold it like you hold a pin, and you will insert it blindly with, as you see here, you will forward the airway. Then you will inflate the cuff by a 20 cc syringe. Now we will go to combi tube. What is the indication of combi tube? Difficult face mask fit, unsuccessful intubation, and difficulty ventilation with bag mask. The third reason is unavailability of a personnel trained in ET intubation. And the contraindication, we have patient with intact gag reflex, patient with known or suspected esophageal disease, suspected upper airway obstruction. All this reason will not use a combi tube. As you see in the picture, this is the combi tube. There is 2 cuff and 2 tube opening, and you will insert it blindly. You will hold the tongue and you will insert the tube. Then you will inflate both cuff. And there is 2 chances. One chance, and this is the most common, the tube will go to the esophagus and through this opening will go the air. The other chance, it is very rare, the tube will go directly to the trachea. This one, so you will inflate, you will do bagging and the air will go directly to the trachea. The last one, in artificial airway, we have the endotracheal tube. This is the most common in code. We will use endotracheal tube. So what is the indication of endotracheal tube? Relief of upper airway obstruction resulting from laryngospasm, epiglottitis, or glottic edema. Protection of the airway. Facilitation of tracheal section. And the last one is assistance in manual or mechanical ventilation. What is the hazard or complication of endotracheal tube? The first one will cause cuff mechanism reduced, damage to the vocal cord, lose patient ability to talk, laryngeal or tracheal edema, and the last one, tube occlusion by secretion. As you see in the picture here, this is the ATT tube. There is cuff and there is balloon here. You will inflate the cuff through this one-way valve. You will put 10 cc syringe. And this is the laryngoscope. You will use it to open and see the view and insert the tube. This is the equipment we need for preparing for intubation. We will need laryngoscope. We will need tube with a stylet. We will need the Yanker section or section catheter. You will need syringe to inflate the cuff. We will need end-tidal CO2 detector, this one to make sure the tube is in a trachea. We will need tape to fix the tube, and oral and nasal pharyngeal airway. As you see here in the picture, this is the way how to intubate the patient. First, you will take the laryngoscope and open the airway, and you will see here the vocal cord and the glottic opening. So you will insert it in this opening. Okay. As you see here in the picture, this is the this is the CO2 detector. This we will use it to confirm the tube is in a trachea. It is color coded. First, it is purple. If the tube is in and in trachea, the patient will exhale and CO2 will come to the device and will change the color from purple to yellow. If change the color to yellow, that means the tube is in trachea. Okay, now we will go to the section. Section is very important to clear the airway. So, as you see here in the picture, there is different color and different sizes. It is color coded. How to choose the size, the right size for the patient. To choose the size of section, we will take the size of ET tube and we multiply by 2, and we will use the next smallest catheter. For example, if the tube is 7, we multiply by 2, this will equal 14, so we will take the smallest, we will take the 12, size 12. Okay, never leave the catheter in the airway for more than 15 seconds. The last thing in our presentation is the ambu bag or manual resuscitation. This is very important. We will use it frequent. So what is this? This is the ambu bag. As you see here, there is mask and there is here valve, patient valve for inhalation and exhalation. And here in down we have the opening for oxygen inlet, and there is one valve also for inhalation and exhalation. This ambu bag, we use it the highest flow rate available. For example, if the flow meter have 15 liter, we will put 15 liter. This ambu bag provides oxygenation and ventilation also. In BLS, we will use the ratio 30 to 2. That means 30 compression, 2 breath. In advanced airway, we will give 1 breath every 6 seconds. There is complication of ambu bag if you don't use it by the right way. Sometimes it will cause hypoventilation or hyperventilation. Sometimes it will cause barotrauma, and sometimes it will cause gastric distension. And that's it for today. Thank you.